Measles. Measles is a highly contagious illness caused by a virus that replicates in the nose and throat of an infected child or adult. Symptoms of measles are fever, rash, inflammation of the upper respiratory tract. This disease spread through the air by respiratory droplets produced from coughing or sneezing. Measles symptoms don't appear until 10 to 14 days after exposure. Cause of disease. Measles is caused by an RNA paramyxovirus called measles morbillivirus. Diagnosis. Laboratory diagnosis of measles can be done with confirmation of positive measles IgM antibodies or detection of measles virus RNA from throat, nasal, or urine specimen. Saliva can be collected for salivary measles-specific IgA testing. Positive contact with other people known to have measles add evidence to the diagnosis. Treatment. There is no specific treatment for measles. Instead, medications are used for treating symptoms and other infections. Giving vitamin A may lessen the severity of measles in children. Patients should maintain good hydration with adequate fluids. Treatment is supportive, that is, with ibuprofen or paracetamol is given to reduce fever and pain. Also, if required, bronchodilators are given for cough. Antibiotics can be given in case of a bacterial infection such as pneumonia or an ear infection. How is measles spread? Measles is highly contagious and spread easily when an infected person breathes or coughs. The measles virus can live for up to 2 hours on a surface or in the air where the infected person coughed or sneezed. If other people can breathe the contaminated air or touch the infected surface and then touch their eyes, nose or mouth, they can become infected. Measles is so contagious that if an individual has measles, up to 9 in 10 of their close contacts who are not immune will also become infected. Its transmission occurs directly from person to person, mainly by droplet infection and droplet nuclei. The portal of entry is through the respiratory tract and in some cases to conjunctiva. Infected people can spread measles to other people from 4 days before through 4 days after the rash appears. High-risk groups. Infants and children aged less than 3 years in developing countries and children up to 5 years in developed countries are very high-risk group. If pregnant women are infected, it can cause preterm labor, low birth weight, and maternal death. Also, people with compromised immunity systems such as from leukemia and HIV infection have high risk. Measles tend to be severe in malnourished children due to the poor cell-mediated immunity response. Measles can be prevented by active immunization. Only live attenuated vaccines are recommended as they are both safe and effective. To prevent measles in children, doctor usually gives infants the first dose of vaccine between 12 and 15 months, with the second dose typically given between ages 4 and 6 years. Measles can be prevented by administration of immunoglobulin early in incubation period. Human normal immunoglobulin is a special concentration of antibodies that can give short-term but immediate protection against measles. Administration of MMR vaccine may prevent measles after exposure to virus. Prevention. To control outbreak, following measures are recommended. Isolation for 7 days after onset of rash, immunization of contacts within 2 days of exposure, and prompt immunization at the beginning of an epidemic is essential to limit the spread. Thank you.